Hi everyone, welcome back to my channel. So today I wanted to talk about, I don't really know how to title this. I guess mind over matter or matter over mind. Basically how, this whole it's all in your head, it's all in your head culture, the things that we've been told by doctors or even our own family members, how it can really backfire. And I have a recent example, and I spoke about this a little bit in another video that I made where I talked about how you need to get testing done while you're symptomatic. Um, I spoke about how, I had bruising and I was going to go to urgent care and I didn't. I talked myself out of it because it wasn't a big deal. Well, I recently had that, that kind of thing happening again. So I spoke to my therapist about this too because, I actually spoke to her about it first and then the situation kept getting worse. But that goes to show you that even those of us who are sick convince ourselves that our issues are psychological. Um, so my birthday was recent. I just had a birthday, and for my birthday, my mom got me a bunch of sweets. I my mother and I have a very very different relationship with food. I've mentioned this in some of my other videos, and there will be a video on fat phobia. It may have already gone up or it may be going up. I have some opinions on it, but we have a very different relationship with food. And she knows that I am not supposed to be having a lot of sugar. I am on a very sugar restricted diet because sugar is very inflammatory. But for whatever reason, she thought it was a good idea to get me a bunch of sweet stuff. So I had like a vegan cheesecake, vegan ice cream, and two vegan chocolate bars. Obviously, non dairy, no wheat, soy, that kind of stuff. And I sat there, and she also made me like my soup, this soup that I really like for my birthday. And I'm sitting there and I'm just like, I can't eat all of this. Like, I can't be eating all, like the cheesecake, I could share with them, but just, I was so overwhelmed. And I even felt my stomach kind of like, like it just, I get very, very overwhelmed seeing a lot of food. And I've always been like that. And I talk about this in the other video. And my mom is the opposite. My mom is someone who needs to see lots and lots and lots of food. Like she is the literally the exact opposite. Like she likes to see tons of food, like an exaggeration of food. So I just start feeling kind of off and I'm just like, oh, I don't, how am I going to eat all of this? And I scheduled like this emergency session with my therapist. I was like, I can't, I was upset about it. I was angry because it's like, that I'm not supposed to be eating this stuff, right? So I scheduled this emergency session with my therapist and I talked to her. By that time it was Tuesday. And I tell her everything that's going on. I say, I can't stand seeing that much of anything. If she would have gotten me, she had already gotten me a little thing of ice cream. I could eat that very slowly over the course of a month. Um, you know, but then to add cheesecake onto that and two bars of chocolate, I mean, it just was so much. And I told her, I said, I just didn't feel, I could automatically feel it in my stomach. And you automatically go, it's like it's a psychological thing, right? It's a psychological issue, which it could be, right? I mean, it definitely could be. What I wasn't realizing was that I was having symptoms of something, and by that Thursday, I was having what I assumed to be intestinal spasms, and I have had intestinal spasms in the past. So I'm panicking because I don't know what's going on. Um, if my intestinal spasms are coming back, if I'm going to start having this issue again because I've been off of my IVIG because I did this other experimental treatment. So I'm just like, what's going on, right? I had convinced myself that it was, this issue with my mom and the food and the, all the sweets. So I went to urgent care. I got some blood work done. She did tell me, she's like, yeah, you've got some like intestinal activity going on there. And she said, I'll run some blood work, see if maybe you've got some kind of infection. We'll do like a fecal test, that kind of thing. Everything came back more or less normal. So I didn't have an infection, but by the time I got home, I did have full-blown diarrhea. So it's possible that I could have eaten something bad. It was not something that was in my head. And it really bothered me a lot that I had convinced myself that I was just having this psychological reaction and it was affecting my stomach because I saw all of this, all of the sweets, the cheesecake and all of that. These are things that I like, by the way, chocolate ice cream, cheesecake, dark chocolate. I love all that stuff. I just know I'm not supposed to be eating all of it and seeing all of it at once. I have a big issue with seeing large amounts of food or a lot of the same thing at once, or knowing that I have to eat all of it. And I discuss a lot of this in that fat phobia video. It's really dangerous, and this has been going on for a long time. This, I was always told as a kid, it's all in your head. This was long before my chronic illness. This was long before I had any, real kinds of issues. That was put into my head by my own parents. Any complaint that I had, whether it was like some aches or pains or feeling sick to my stomach, it was always down to stop thinking about it, breathe in and out, calm down. And so it was always dismissed. And I'm not really sure why. I think a lot of it, to be totally honest, is lazy parenting. There are parents that they just don't take their children seriously. There are a lot of people that see their children as accessories, or they just never learn to see their children as separate people. And so they just kind of dismiss them and brush them off. Their complaints are not really legit, and that does happen. So, this was set in motion since I was a kid, and then of course, as I got older, I developed panic attacks. So it was almost like a self-fulfilling prophecy, that I was convinced my issues were mental, psychological, and then they did become psychological. Because I started having panic attacks and that kind of thing. And, it's dangerous. And I look back and now I'm starting to reevaluate what happened to me as a kid. I could have been having acid reflux because that was something that the doctors did mention to me when I was younger. Then they did give me a prescription for like Tagamet or something. Could have been having acid reflux. I was complaining of nausea, right? I could have had candida issues because I was always taking antibiotics before dental appointments because I had a heart murmur. So that could have been another issue. I had eczema. So I was already showing signs of something. Something was a little bit off, right? My niece now has anxiety attacks, and other people in my family have anxiety attacks. I look at my parents now and I'm like, they're both very anxious people. Theirs just manifests in a very different way. So it could be that we are genetically predisposed to anxiety. I look back and I think to myself, I could have been having physical issues much younger, right? That predisposed me to worse illness later down the line. My brother now is also having, like rheumatoid arthritis, some kind of inflammatory condition. Doctors do this to patients as well, where they dismiss them. They say, it's mental. And I have had doctors do that. I've had doctors do that even post, diagnosis, still try to convince me that my issues have more of a psychological origin than physical. And, you just really, you yourself have to be the best judge of that. And sometimes it can be difficult. Sometimes your mind can play tricks on you. And I have talked about that on here. But it's also seriously considering, am I having physical symptoms? For example, diarrhea or having rashes or things like that. Um, you know, how many doctors have I seen? Have I gone to physical therapy? The one thing that really, really was my saving grace were my physical therapists. Sorry, I'm having a very difficult time talking today. My physical therapists were the ones that validated the fact that I was having some kind of muscle problem. So I would go to my physical therapist and they would ask me if I had gotten into an accident, if I had had a really bad fall, something, some kind, a surgery or something that had caused the muscles to stop functioning properly. So once I saw that my physical therapist, and it wasn't just one, it was several, um, two that were the primary ones that were just like, there's something going on here. Once I saw that, I was like, this is not just in my head. I have people here that are telling me something is wrong. Sometimes you have to look for the right professional. If you're having neuromuscular issues, that may be a physical therapist. Because sometimes that kind of stuff doesn't come up on an MRI. A neurologist can't really diagnose it. So it really, I now have a neurologist at UCLA who is a movement disorders specialist, right? They deal with movement disorders, which is not, not all neurological conditions are movement disorders. So you sometimes you have to look for the right person. Um, but sometimes can it be psychological? Yeah, it can be psychological. I was fully convinced that my stomach issues, I was like, it's got to be related to this, you know, seeing all those sweets. And luckily I didn't talk myself out of going to the doctors this time, and I did go and I did get testing done. But I just, this is one of those prime examples of how bad it is to tell patients um, that their issues are all in their head. And this is why I stress on this channel. I have always stressed that you need to have a therapist even before you're seeing doctors, because the first thing that they're going to tell you, and I had a physical with a new doctor because I'm looking to change my primary care doctor. They will always ask you, do you have a therapist? Are you seeing a therapist? And if you say no, they're going to be like, see a therapist. That's becoming more and more commonplace. Doctors are going to that first, not just with us, not just with those of us with invisible illnesses, but even with people that have cancer. That happened to my nephew. They wanted to say that all of his issues that he was having were psychological problems, right? So sometimes having a therapist already, I told the doctor, I said, yes, I have a therapist. I see her every 2 weeks, and, she's on it. And so she goes, oh, okay, that's great. So she has no excuse not to run blood work or not to refer me to a rheumatologist or whatever. And even she was the one that suggested I see a rheumatologist, right? Because once you have all of your bases covered, the only thing that they can do is check and see where there's holes and fill that hole, right? I don't have a rheumatologist. I don't have a regular rheumatologist. So maybe that's something that I should consider. Um, you know, it does take a long time, and I know a lot of people, from what I've seen, in the chronic illness communities, at least online, a lot of people are resistant to seeing therapists or to having a regular therapist. And you know I get that. I understand that we've become sort of therapist averse because we don't want, we don't want to validate people's assumption that our issues are all in our head. But I do think that a lot of us have a lot of stress related problems that could make our illness worse. But like I said, having that therapist from the beginning will eliminate will eliminate that excuse for doctors. Doctors can no longer use that excuse and tell you you need to see a therapist. And that has worked very, very well for me. And that's why I always stress it on this channel. It may take you a while to find the right therapist, but I think it's necessary, especially if you're continuing, on this chronic illness journey. And yeah, I do think that there may be some cases out there where people do have psychological issues that are causing them physical illness. But I would say it's probably the most common where both are occurring at the same time, where you have physical illness and psychological illness. And that really, really complicates things. And I've talked about that a lot in other videos. But I hate that self-doubt. I really hate that self-doubt. And it really bothered me that I have started to internalize what I was told as a kid, that my issues were psychological, that nothing that I had was actually real, that it was all just a mental problem. And you do start to internalize it, and then you start to question and ask yourself, am I really feeling what I'm feeling? I've been doing that a lot with the exosomes treatment. I keep telling myself, it's working. I keep saying it's working, it's working, it's working, but I just keep feeling worse and worse and worse. And so it's like, okay, well, and then I don't have a doctor that is really helping me out and helping to clarify those issues. So it does get confusing, especially when when that idea has been put into your head since you were young. It's very difficult to see a clear picture of your own health and your own body when you've been told to doubt it for so many years. I don't, I really would like to explore, and I should really talk to my therapist if there's any type of therapy to learn to trust yourself more and to learn to trust, your own instincts and your own, your own body and what your body is trying to tell you. Because I do think, and I see the opposite. Speaking of that, I do see the opposite, and I see the opposite a lot in my family, particularly my mom's side, where there's people that are literally just falling apart from neglecting their medical issues. We have several diabetics, and they just, it's like living in constant denial of their issues, and they just become sicker and sicker and sicker, and just living their lives, not modifying their diets or following doctor's orders. And so it also goes the other way, where it's like, I just refuse to accept that I have an illness, and I refuse to. So I think it can go both ways, right? You doubt, your actual physical illness, or you just refuse to accept that there's a physical illness there, that there's anything that actually needs changing, or that it's not really going to hurt me. I'll just eat this. It's not really going to do anything to me. And that runs rampant on my mom's side. And a little bit on my dad's side as well. But, that denial of illness. I actually have two cousins who died very young. One of them was in his mid-20s. The other one was in his mid-30s. One of them died of diabetes, which is, it's not, I don't think it's as common to die of diabetes in this day and age, because he kept ignoring his symptoms. He was just like, I don't feel, and by the time he really did not feel well, it was too late. And then the other cousin, he died of a brain tumor, and he actually drove himself, and I'm pretty sure I've told this story a few times. He drove himself to the hospital, to the emergency room, where they diagnosed the brain tumor, because he had been complaining about it to his family, and his family just kind of laughed it off, or, made fun of him. And that's sort of the general vibe in my mom's side of the family. Medical issues are stupid. There's nothing really wrong with you. You're just, they don't tell you that you're weak. It's just stupid, right? It's just dumb. We're not those kinds of people. We don't run to the doctors for every little thing. And, and they all have issues. I had an uncle with quadruple bypass. My mom has been hospitalized a few times for like heart-related issues. They all have suffered from obesity and obesity related problems. And again, it's ignorance. It's ignorance and denial And I honestly, like, I never knew my grandmother, so I don't really know. And my grandfather had died long before he died when my mom was a kid. So I don't know where that attitude originates. I imagine it was from my grandmother because she's the one that raised them. But it's really, it's mind-blowing, you know. And the people, I see people that take care of their health and that are really health conscious, and I'm just like, that's dumb, you know. My automatic thinking is that that's really dumb. um, but they're really, you know, those of us who are sick have a really weird relationship with our bodies. And I think learning to trust ourselves, right? To trust ourselves enough, and, you know, to say, okay, well, I need to go to the doctors today, or I don't need to go. That can be really difficult, especially when you're dealing with ongoing chronic stuff. But anyways, I've gone on long enough. This was just, I kind of needed to vent because that was something that had happened recently that it really upset me, because I kind of felt like I was just learning to trust my body, and my body is relatively predictable. And since the exosomes, things have been crazy, and it's becoming very complicated and very overwhelming. So just wanted to throw that out there, and hopefully this will be helpful to somebody, because I know that a lot of us deal with this. A lot of us deal with being told that we're not feeling what we're feeling. So thank you so much. Please like and subscribe, and I will see